Hello, I'm Dr. John Hancock, Executive Dean of McGovern Medical School. Innovation is at the very heart of modern medicine. Advances in imaging, organ transplantation, gene therapy, and immunotherapy, to name a few recent technological advances, have all contributed to better health outcomes. Now, a new dual degree program offered by McGovern Medical School and Rice University, the MD-MBE program, which stands for Doctor of Medicine and Master of Bioengineering, aims to prepare the next generation of doctors for tomorrow's innovations. Medicine is changing, and we need clinicians who are conversant in disparate fields such as computer sciences, mathematics, and engineering. The MD-MBE program is an important step in this direction. Let us hear more about how McGovern Medical School and Rice University are forging a path to innovation.
Rice's dual MD-MBE program allows McGovern students to pause in between their third and fourth year and join Rice Bioengineering for our professional master's program. Although this collaboration started in 2020, it's a natural progression of the fact that the Texas Medical Center, being the largest in the world, many of the innovations that have come from the Texas Medical Center have been as a product of multidisciplinary teams. This dual MD-MBE gives medical students the opportunity to work with bioengineers and bioengineers to learn from current medical students who bring a unique perspective other than their own to the projects and classes that they take together.
So the timing of the Master's of Bioengineering program for the McGovern students is critical. They've had 3 years of their medical training, and they're going into that program after their first clinical year and really are able to apply those clinical pearls, those clinical skills that they've attained in the world of engineering, and to create devices that they think will be helpful in the patient care setting.
When I was on my third year clinical rotations, it was the first time I was in the hospital for extended periods of time, and I saw all the issues that patients faced, and I saw how we as healthcare professionals were able to address those issues. But I also saw how there were a lot of issues that we necessarily weren't taught the skills to address in medical school because we didn't learn how to think like engineers or build tools like engineers. So we were using these devices and we were using these algorithms to treat our patients, but we didn't necessarily know how these algorithms and these devices worked. And so that's what initially drew me to the MD-MBE program, is to try and get that other perspective so that I could work on projects with engineers and with clinical practitioners.
I was given the opportunity to participate in the Healthcare Innovation Challenge here at McGovern, where we came up with innovative ideas to a challenging problem, but it sort of ended there with the ideas. And so I wanted to take the next step and bring those ideas to real life. And I felt like when I heard about this program, the bioengineering program, that it was really ideal for me. And so after third year, I pursued the program. I was in the Global Medical Innovations track of the bioengineering program, which is an intersection of medicine, engineering, and business within the medtech world. And none of these things I had any experience in prior to pursuing the engineering program, except for medicine, obviously. But I had the opportunity to develop a low-cost retinal camera for diabetic retinopathy screening in low-resource settings. I've made a lot of connections within the Houston world, within the medtech industry, which will definitely be helpful going forward in the future.
The students that have been part of this program have reported that it is a dramatic change of pace from medical school education, one that is positive, but it broadens their perspective on how they might innovate for unmet clinical needs or how they might explore research topics specific to what they wish to practice as a clinician in the future.
Combining medical training with engineering and business skill sets will prepare a future generation of doctors who are ready for innovation. We are proud to offer this prestigious collaboration with Rice University and look forward to the new technological advances that will follow. Thank you for joining me for this episode of Hancock's Headlines.